Management of patients with infectious diseases. Emerging infectious diseases include Zika virus, West Nile virus, Ebola viral disease, Legionnaires disease, and Pertussis. Many factors contribute to newly emerging or re-emerging infectious diseases. Some of these factors include increased foreign travel, population growth, increased urban crowding, ecologic changes, risky sexual behavior, antimicrobial resistance, and breakdown in public health measures. Zika virus was discovered in the Zika forest in Uganda in the 1940s. It was found to cause human disease in the 1950s, and its first large outbreak in 2007 was located in Micronesia. It was first seen in the Western Hemisphere in July of 2015. It is transmitted through bites of infected mosquitoes and has been transmitted through sexual contact. The incubation period for Zika is just a few days. Patients normally experience 2 to 7 days of mild fever, rash, headache, conjunctivitis, or joint and muscle pain. Zika has been found to cause congenital abnormalities in pregnancy. The virus can also cause Guillain-Barré. There is no current vaccine. Standard contact precautions should be used to protect healthcare personnel from disease transmission. West Nile was discovered in the 1930s in Africa. It was first seen in humans in the United States in 1999. Less than 1% of infections develop into the more serious West Nile virus. The virus is transmitted via mosquito bite. In very rare cases, it has been transmitted human to human. The incubation period is between 3 and 14 days. Approximately 20% of people who are infected have a mild disease called West Nile fever. These patients usually experience headache, fever, and a persistent fatigue that may continue for several months. The mortality rate for people with this milder West Nile fever and meningitis is less than 1%. West Nile virus is the life-threatening version of West Nile. High risk of neuroinvasive illness in patients over 50 can cause meningitis, encephalitis, and paralysis or poliomyelitis. The mortality rate is approximately 20% for those with encephalitis. Currently, there is no treatment for West Nile virus infection. Medical and nursing management consists of fluid replacement, airway management, and supportive nursing care when meningitis or symptoms are present. There is currently no vaccine. Since the virus is transmitted via mosquito, standard contact precautions should apply. The first human outbreak of Ebola occurred in 1976. In 2014, it went on a rampage in the West African countries of Liberia, Guinea, and Sierra Leone, and secondary cases in the other countries in Africa, Europe, and the United States. Ebola is spread through direct contact with blood or body fluids such as urine, vomit, feces, saliva, sweat, semen, and breast milk. Occasionally, it can be spread by handling infected bats or infected wild animals. It is not spread through air, water, or insect bites. The incubation period, 2 to 21 days. Ebola virus is only detected in blood after the patient becomes symptomatic. Patients are not contagious to others before symptoms occur. If there are no symptoms by 21 days after exposure, there is essentially no risk for developing Ebola. Ebola's clinical manifestations initially include a high fever, muscle aches, and fatigue. Between the third and fifth symptomatic day, patients will experience severe diarrhea, abdominal pain, and vomiting. This places the patient at great risk of severe dehydration at this point. Many produce over 5 liters of liquid stool per day. Patients will also experience increasing neurologic symptoms during that period, such as confusion, agitation, delirium, encephalitis. Approximately 5% will develop bleeding or hemorrhage, a very poor prognostic indicator. Patients who do not die during the first 2 weeks of the disease are likely to survive. Treatment for Ebola includes supportive maintenance of the circulatory system and respiratory system. It is highly likely the patients will need ventilator and dialysis during the acute phase of illness. Healthcare workers are at increased risk for acquiring Ebola and should wear complete PPE. Patients should be isolated in a private room away from other patients. Currently, there is no vaccine for Ebola. Legionnaires disease, also known as legionellosis, is a form of atypical pneumonia caused by any type of Legionella bacteria. It is named after an outbreak at a convention of the American Legion in 1976. It is a waterborne illness, and its manifestation increases in the summer and autumn months. There are approximately 5,000 new cases each year. Who is at risk? People 50 years or older. People with a chronic lung disease, like chronic obstructive pulmonary disease or emphysema. People with weak immune systems or who take drugs that weaken the immune system. Immunocompromised patients are at high risk, including HIV, hematologic malignancy, end-stage kidney disease, diabetes, smoking, or the use of immunosuppressive agents. The known causative vectors of transmission include hotel or cruise ship plumbing and air conditioning systems, whirlpool spas, and decorative fountains. In hospitals, patients may be exposed to aerosols created by cooling towers, water exposure from an in-room plumbing, and respiratory therapy equipment. Person-to-person transmission, if it occurs at all, is extremely rare, and the mortality rate for Legionnaires' disease may be as high as 10% in some populations. The lungs are the principal organs of infection. The typical incubation period ranges from 2 to 10 days. Early symptoms may include malaise, myalgias, headache, and dry cough. The patient can develop increasing pulmonary symptoms, including productive cough, dyspnea, chest pain, and pneumonia. Patients are usually febrile, and body temperatures may reach or exceed 103 degrees Fahrenheit. Diarrhea and other gastrointestinal symptoms are common in severe cases. Multi-organ involvement and failure may follow. Complete a good physical assessment with chest x-rays and labs to include blood, urine, and sputum tests. The CDC recommends these multiple tests when Legionnaires' disease is suspected because none of the tests is completely accurate. The antibiotic agents of choice are azithromycin, moxifloxacin, and doxycycline for the treatment of Legionnaires' disease. Isolation is not required, and management includes treating the illness like any other pneumonia. There is no vaccine for Legionnaires. Pertussis is more commonly known as whooping cough. Rates declined until the 1980s when the disease began to reemerge. Incidences doubled between 2010 to 2014. Transmitted by droplets, the illness is highly contagious. Healthcare providers should observe strict droplet protection guidelines. Patients usually present to healthcare professionals with a sudden paroxysmal cough that is accompanied by a characteristic whoop, a high-pitched noise heard when inhaling. This is the most common sign of whooping cough. Pneumonia is the most common of the respiratory symptoms, but the disease can lead to seizures, encephalopathy, and, although rare, death. Symptoms are severe for infants who have not yet been vaccinated, but people who have been vaccinated seldom have severe disease. Most diagnoses of pertussis are made, at least initially, without laboratory confirmation. The clinical case definition is a new cough lasting at least 2 weeks, with inspiratory whoop or vomiting after cough. Laboratory confirmation can be made by clinical culture or by polymerase chain reaction assay for B. pertussis. Medical management would include antibiotic agents such as azithromycin, erythromycin, erythrocin, Biaxin, and Bactrim. DTaP vaccine for infants and children, and Tdap vaccine for preteens and adults.